Welcome to Business and Technology in Bermuda. Our goal is to meet with the leaders and thinkers shaping our island's economy to discuss what it really takes to build, scale, and sustain a business in Bermuda today.
So hi, good morning, or afternoon, I think technically.
Yeah.
Good to see both of you. So obviously, you know me, and I need no introduction because it's my podcast. But happy to hear about you guys and be introduced to both of you. I know Claire, but I've only met you once. So please give your backgrounds, your businesses, and we can just go from there about basically healthcare.
Awesome. Sure. So my name's Jennifer Burland Adams. I'm born and raised in Bermuda, and I have two companies. One's a nonprofit consulting company called Wavecrest, where we specialize in fundraising and helping nonprofits be set up for successful capital campaigns. And then Claire and I met when I was developing that at the Ignite program and stayed in touch and stayed friends. And so now we both co-own Epic Wellness, which is what we're here to talk about.
And then Claire,
Yeah.
so you have a nursing consulting that I know about. You guys did Fit to Fly,
Correct.
which I remember but didn't know was you.
Yeah.
So thank goodness for decent AI research. So happy to hear about your background, and then we could talk about the consulting first, and then Fit to Fly, and then I'd love to hear about the capital raising for, I'm assuming healthcare is one of those things. But
Oh, that's awesome. Yeah, so my name's Claire McDevitt. I own two companies as well. I'm the CEO of Healthcare Solutions. That is a nurse-based organization where we specialize in home care, occupational health, and we also do healthcare management. So basically going out into doctors' offices and facilities to help them streamline their businesses, look at their strategic plan and trying to, bridge that gap from somebody needing care and getting to their office in a timely way. So providing the right care at the right time.
And I know that, healthcare is a big topic right now in government in Bermuda, probably directly in your hemisphere. There's a new senior care center opening up. Mm-hmm. We've had this big expose by Dr. Schultz, who I had the pleasure of working with when I was volunteering as a paramedic. He was, I'd love to say publicly, he was fantastic to work for and work with at the hospital. How do you guys see healthcare today? What is Bermuda doing right? What do we need to improve? I think people who live and work here, everyone has an opinion on healthcare in Bermuda, but you guys are in the middle of it. And obviously you had a lot of experience even during COVID, post-COVID. It's a different universe, it seems, post-COVID. I don't know if everyone's really recovered from finances, from business, from healthcare. It kind of threw a grenade in the middle of all of those things. So just happy to hear what you think about what we're doing. I would say for just my 2 cents on an opinion of the hospital, I've had a few run-ins with the hospital. Playing rugby is certainly one of the reasons I end up going there sometimes. And surprisingly, I guess maybe unsurprisingly, it was a great experience. Mm-hmm. In my limited need, I needed to have a hernia surgery, and I had an arm surgery that was done here but overseas as well. So where are you guys today, and how does your business kind of fill the gaps that every country has, I suppose?
Yeah, I think the problem is not just unique to Bermuda. You have to remember the hospital is like an acute service hospital. That's its main business. So when you get delays and bottlenecks, it impacts the acute services, whether that's surgery and the ED department. With Healthcare Solutions, we do case management and we do transition of care. So whether it's from overseas or the hospital, we are actively trying to have people stay in hospital only for as little time as necessary, and then we can care for them at home. And it's kind of formalizing that now. We're working hard, putting together, projects and plans to kind of formalize that case management approach so that there's more of a connection from the hospital and the community, so that when somebody is ready for discharge, that we know about it ahead of time versus like the day off. There's a lot of stress on the family when someone's discharge is kind of presented to them too early, where they don't feel they're ready to support that loved one. You have a lot of people who are independent and who become then completely dependent. And that can put a lot of stress on the community and the family. So if they're not aware of the services that are available to support that person at home, it can delay things, right? I don't think it's necessarily totally, we hear the word granny dumping. I don't think it's necessarily that. I think it's just repositioning a lot of the services and the resources that we have. I agree that COVID has still played an impact on people because of financial and human resources. A lot of people have burnt out or have left the field of, like, say, healthcare. Also, there's how many nurses are being trained. You can talk about like nurse practitioners, are they being utilized properly within the services so that you can alleviate some of that pressure to those specialists. But at Healthcare Solutions, we were constantly case managing to try and keep people out of hospital so that they can live longer and well at home with a little bit of the support that they need.
And I guess we always focus in Bermuda on the hospital because it's easy to.
And it's our only hospital.
It's our only hospital. We have the urgent care center, which is run by a hospital, but healthcare in Bermuda is much, much bigger.
Yeah.
And it's not just, your loved one goes to the hospital and then they need services when they get out. I'm sure there's tons of gaps here that we need to fill, or you're trying to fill with your businesses on as people transition, senior citizens, but also, the other bits and pieces. You guys did Fit to Fly, which is a really cool concept if you want to talk about that, but that was a response just to COVID.
Yeah.
How was that during COVID, and has it transitioned a bit post-COVID? What does that look like today?
Yeah, so as I said earlier, we met through Ignite, we kept in touch, and then during COVID, when the government opened up testing to people outside of doctors' offices, because doctors' offices were inundated with just their normal patient load, and then having to take on people who wanted to travel and get the travel certificates, it was a huge load. I literally sent Claire a WhatsApp with the link in the Royal Gazette and was like, hey, you should look at this. And she came right back and was like, well, do you want to help me with it? So that's how we did Fit to Fly. So as soon as we were approved to offer that, within 6 hours, we had our website up, and within 24 hours, we had our first person who was on Zoom with our nurses doing certified antigen testing. And we were able to help government and the BTA open Bermuda back up to visitors, because it didn't really matter where you were in the world.
You needed an antigen test.
You needed an antigen test, and there was a list of hundreds of tests that were acceptable. So anyone could go to a pharmacy near them, a grocery store near them, whatever. And as long as it was on that list, we were then able to watch them on the screen, take the test, watch the test develop, and then provide them with a certificate so that they could travel here and then they could leave again as well.
Was that the first? I would imagine it's not the first, but was it the watershed moment for telehealth?
Yeah, I think the doctor's offices and we're trying to understand what telehealth looked like, because you have to remember a lot of our specialists are overseas, so suddenly they can't travel to Bermuda. So we were trying to go, well, can we link in with pulmonologists that are out of state or out of country, and that was proving very challenging. But in turn, in Bermuda, then the telehealth did open up, and it did help tremendously.
So that was your first business dealings together.
Yeah, and it was short-lived because, governments around the world were like,
hopefully.
wait, this is a lot of work to get people to start traveling again. Yeah. But it showed us that we could build something quickly that was effective, that was popular, that made sense, that was efficient, and that we worked really well together as business partners. And that's, I think, one of the most important pieces in any kind of relationship, partnership, and especially in a business relationship. And so we were always looking for the next thing to do, and that ended up being our DNA and epigenetic test kits, which really kind of give you a health and wellness blueprint. And so when you asked sort of earlier about, what can we do, what do we see as innovating, there are wearables, there are DNA tests, there's all sorts of, I've got my ring on, my ultra-human ring.
I'm a Whoop user.
Yeah. You can get a lot of data on yourself. And that's what we found, is that people were really interested in the results, and then they just didn't really know necessarily what to do with them and where to go with them. And so they'd get back this really interesting information. You're naturally deficient in this. Your body does really well with this. You're not absorbing this. And also sort of your inflammation markers and things. What can you do with this information? How can you get healthier? How can you get more well? And so that's when we started up Epic Wellness.
I've had a mixed bag here when it comes to, I guess I call myself a biohacker. I don't know if I call myself that, but the outside world would probably say that. I do as many things that are logical. I'm on the peptide train. I've been taking creatine for 20 plus years. And then I think the research caught up to, what all the weightlifters were doing back when I was in high school. It was always protein and creatine, and we think it works, but there's not a lot of good evidence, but just do it, right? Obviously, I'm on the Whoop train. I wear a Samsung watch that basically does the same thing, getting two different sets of data. But my experience here has been a bit weird. I would say, I've had one specialist who was you don't need to take vitamin D, you don't need to take supplements, you don't need to take, vitamins. And, I think some of the research would probably back some of that up. Rumor has it 50% of the vitamins you might take in a day, and I take a lot, are probably just completely wasted. And then some of the things, like I think vitamin D research has shown that, especially living indoors most of the days, we're not outside. How often am I outside? I work at a desk job.
Right.
Are actually quite helpful, but certainly dismissive, I would say, from the specialist. And then even my primary care, we have, very polite. She's wonderful, and I'll keep her name out of hemisphere. She probably doesn't need more headaches in her life, but she's wonderful. But at the same time, and I love her as my doctor, to be honest. I would have switched if I didn't. Every year we have a discussion, if not a fight, about creatine.
Yeah.
And I think the research is well on my side on those things, but I don't know if biohacking or wellness maxing or genetic testing to try to find, early case markers for cancers. There was a famous actress, her name escapes me, who had both breasts removed because she had very early signs of breast cancer and just went straight to the top of that fight. Are we getting there in Bermuda? You guys seem probably one of the first over that wall to try to look for ways to increase people's wellness. But are you seeing a pickup for that here? Like, do people care about those kind of extra things in their healthcare?
I definitely think people care. I think people can now come to the doctor's appointment fully informed. So it's kind of going in and going, we're going to have a mutual conversation. Like, I think historically people would go into doctor's offices and kind of just take what the doctor says and then kind of leave. But you have to remember, if people are being put on medications, and it's like a one-fit-all type of medication. So all three of us are very different, and all three of us could have high blood pressure, and all three of us would be put on the same medication, but each is not going to work naturally for each of our bodies. Right. So that's the information how I would educate somebody on it. The blueprint of the epigenetic test tells you, for instance, when I did it, I drank BCAAs all the time when I was training for triathlons and stuff. So every month, going to the health store, picking up all the different things that I thought my body needed, and I didn't even absorb it. So if I calculated the amount of stuff that I wasted versus the doing the DNA test and knowing that it is just not a good fit for my body, and I need to focus on simple things like B complex and vitamin D, which would have been a much cheaper option had I known. Right. So it just makes me more informed of what I need to take that my body needs, because it's my DNA, right? And I can ultimately change the epigenetic profile on top of that.
So when you pull a profile, I'm assuming it's looking at, top 50, top 100. I'm very curious to hear, what it looks like when you pull a DNA profile.
Yeah, so it's looking at thousands and thousands of different genes. And so it pulls reports based on different areas. So liver function, kidney function, heart function, all of those different pieces. We also have an AI tool, so we can ask it questions. So if you come in for a consultation, when we've done your DNA and epigenetics, we've got your results back, you say, these are my 3 biggest concerns, or this is what I'm worried about developing, or, I just don't know what to do about this. We can ask the AI, and it's going to go directly into your reports and your DNA and give us those answers. I think the other thing that it's really useful for is informing those conversations with the doctors. So, for example, one of my fears is becoming blind. I don't know why. No one in my life or family is blind, but I just feel like that's one of those things that would really be a challenge, right? If for some reason I had vision loss. And when I got my epigenetics back, it said that my eyes are 10 years older biologically than I've been on this earth. And that was really concerning. And so then I went deeper into the DNA reports and looked at my eye health. And I am at a much greater risk than the normal population of developing open-angle glaucoma and cataracts. And so when I went to my optometrist for my annual appointment, I could bring that information with me. And to her credit, she listened because, as you said earlier, some doctors are not as up on this, or they haven't researched it, or they don't have the time, quite frankly, in your normal 20-minute annual visit to listen to all the different things that you've been thinking about and looking at for months, and then you come in with your whole list of things. But to her credit, she listened, and she's like, okay, great. Well, what we can do is some baseline testing and then some additional annual testing. So open-angle glaucoma, that's the one where your sight from the outside starts receding in, but by the time you notice it, it's visual for you, you can't gain any of that back that you've lost. You can stop it, but you can't gain anything back. So there's a test you can do, the peripheral vision test, where I can't see this, but if I'm in a box where it's dark and there's a light up here, my peripheral vision, my brain will kick in and I can figure that out. So we now do that testing on an annual basis, and luckily nothing's changed, but we have the baseline. We know where I was, and so if something does start to change, it'll become quite easy to figure that out.
Is this the first, or in the slew of where concierge medicine is kind of going? Dr. God, I can't remember his name. He was one of the first I saw in Bermuda. I can't remember his name. He was the first I saw that was offering like concierge pay $50 a month.
Dr. Darling.
Darling, yes. He was my grandparents' doctor. He was the first where you paying $50 a month and you kind of get unlimited access to him. And I thought that was maybe 50 is the wrong number, but it was
probably not these days.
it was an amount of money that to me didn't seem, eccentric.
Right.
And it was the first time I saw at least someone in Bermuda offering kind of that unique, more publicized concierge. Is this the first thing you guys are seeing or doing? Is there other things coming down concierge medicine that you guys are thinking about?
I mean, I think it's the data and bringing all the data together. Talking about AI, Claire has a great subscription to Health AI that helps. So I don't have to talk about that.
Yeah, it's just I had to submit like my certificates to show that I was qualified to be able to register to this particular AI. So that helps me a lot. I know it's evidence based. I know where the information is coming from, because with AI you have to take everything with a little bit of a open mind,
right,
and make sure that the references and stuff are secured. But what we found with the epigenetics test was that people were definitely interested. We had a high amount of people that would come in who are data driven, like yourself, wear all the different watches, love to see, what it says. We also had a lot of women, because it tells you your biological versus your chronological age. But then what we were noticing was, okay, we need to build out from this. So here we are giving all this information to somebody, but now what do we do, right? We're all data driven. It's sitting in our inbox, but are we actually actioning on it? And that's then when the DRIPBaR, we started the DRIPBaR within Epic Wellness. So that's your IV vitamin infusion. So I can now look at your and you don't have to have the test done, but now I can tell if you have the test done what your body is going to absorb and be the most benefit to you.
Right. Yeah. I mean, I love the idea of conscious medicine. I love the idea of AI. I probably half my IT business now is AI. I probably am a lot more trusting of it than many people, but I trust it in the realm of I fact check it and then I have other AIs fact check it.
Right.
And that's a lot of work.
That is,
to be honest. When I look at my labs, I have 2 or 3 different AIs look at it and tell me, and then I ping it back to my doctor and say, am I actually low on iron, or what is my game plan? But I do hear a lot. I mean, we're working with a lot of health practices in Bermuda to get them on new EMRs and new AI, or AI at all, because I think a lot of providers, as much as I see a lot of hesitation with a lot of healthcare providers who I suspect are using AI, but then when it comes to the practice as a business, they're like, oh, we're hesitant to adopt it. But I know you go home, and I know you go on a ChatGPT, and I know you ask it medical questions for you and your patients, right? But it's getting them over a bit of that hurdle to say that I believe, and this is my opinion, you don't have to adopt it, that it is going to dramatically change healthcare. I mean, they're talking about radiologists right now who are probably going to go extinct. You're seeing 99% detection rates from AI looking over radiology. And radiology is going to change. And that's just with that subspecialty, right? Imagine the other specialties. Imagine, like you said, I can go with my genetic testing and my lab markers, and I can sit with my doctor and have a really strong game plan in that 20-minute session. And it's also a bit unfair to some of the doctors, because this is, they've been out of medical school 10, 20, 30, 40, 50 years.
Right. Well before the advent of AI.
Right. I mean, the medical books have been written 5 times, right? Imagine you're a specialist in cardiology. You've been out of medical school for 30 years. How many times has cardiology changed, right? So I'm wondering how you're seeing that adoption happen. Are you thinking providers are catching up, or are we as a population just overloading them with genetic testing and lab markers? And, Gemini AI told me I'm going to die in 5 years because I have genetic markers. Or
well, there's that. Isn't there like a scan you can do now? It's like an MRI, full body MRI, and it's meant to give you like all the data that you need. Right?
The DEXA.
Yeah. So somebody asked me would I do that, and I would be hesitant to do it, because what it's going to show is every lump and bump that may be potentially or may not be something down the line. So it depends on your personality. It depends on how you receive that type of information. Because if I'm told there is, certain abnormalities in your lungs or wherever, what am I going to do with that information? I have to have a plan. So I'm not against it, but I would kind of say to somebody, have a plan. So if and when somebody tells you something, what are those next steps and how are you going to manage that?
And it's also critically a healthcare resource problem.
Mm-hmm. Mm-hmm.
If I walk into my doctor's and I say, I want to be, and I would happily do it, one of those people who want the full body MRI, I need to get slotted in one of the 3 MRIs on island and take up a slot that hopefully is needed by somebody who's actually sick, right? And I just want to go get it. Mm-hmm. So there is a resource problem, and it is a tough thing to balance, I think, for the physicians. I think a lot of physicians are worried about healthcare utilization.
Mm-hmm.
Yeah. I think that's where private wellness clinics, longevity clinics, that's where they all kind of jump in, is that you don't want to take a slot away from someone who's just had a bike crash, right? Like, you don't want to be unnecessarily taxing the health insurance industry either, right? Our health insurance keeps going up, and part of that is because we have access to more and more, right? Because technology has advanced so much. And so that's where I think those in the wellness space are kind of filling that kind of a gap. I think AI is going to be a fantastic tool, but this data out is only as good as the data you put into it. So the more information that you can get to put into the AI, and we do have clients that use AI and they've uploaded their DNA, they put all their lab work in, all this kind of stuff, and then they will come to us with saying, well, it says this, what can we do? And so we have to look at everything holistically in order to come up with a plan. And so at our disposal, obviously we have the testing, but we have the IVs, we do IMs, we've got red light compression, lymphatic, we're in peptides now. And most of it is now driven, certainly on the private side of things, by the consumer, right? Mm-hmm. They're the ones, they've done the research, they've done the testing, and they don't want to end up in their doctor's office. Now, we always encourage them, absolutely do at least the minimum, go see your doctor, get your blood work done. We want to look at those things as well. But there's so much more that you can do now as a consumer that you have access to.
I love, and I've had good success with peptides. My knees especially, I have very bad knees, and I've been taking BPC 157 and TV 500.
Yep, that's the one.
It has, and I've done everything up to stem cells.
Okay.
And I was like on the plane to Mexico was the next jump for me because I couldn't get my knees in any better shape. I tried all the rehab and everything. And then I called my local sports medicine doctor, and I said, I want to try this. He signed it off, gave me a script, so just in case I needed it. And it's a gray area in America. In Bermuda, it's probably stricter in Bermuda if I were to look up more specifically. But wow, like N of 1, very poor study of myself, but like 3 months, like my pain level dropped by 75%. My swelling is gone. Like my swelling was bad. But again, there's 2 sides to this story. These peptides are 100% coming out of China. You're trusting the third-party vendor that you're buying them from, that they're legitimate. You're hoping you're getting good testing from the labs they claim to send the testing to. I can't verify all that, as one human being looking at paperwork. I don't know how legitimate this testing is.
But I can tell you, all 3 of us have taken that peptide for the exact same reason, and all 3 of us have had the exact same result. So there's 100% right there.
That's good. We're heading in the right direction.
Right? I'm just telling you, I had a knee injury post-fall, and I was back wearing heels in 2 weeks. I couldn't even walk downstairs with it, and I started taking it straight away. And Jennifer,
and it helped me. I had shoulder surgery a year ago, and I took it for the 3 months after the surgery, and both my surgeon and my PT were amazed at how far ahead of the curve I was, and I was in no great shape ahead of time. So there's nothing else that changed in terms of what I was doing except adding that peptide in. Yeah.
And I asked when I had a tricep surgery, and I tore my tricep, and it was like, it's such a rare thing. I could only find one surgeon on the entire East Coast who'd done 6 in 2 years.
Wow.
So... And
so
I asked
went to him.
I went to her. Yeah, she's head of ortho at Leahy, and I said, I want to take. I've been reading. I mean, listening to podcasts and then Googling afterwards about this peptide BPC 157. All the UFC guys. So UFC guys, if you follow that sphere, those guys are on stuff way ahead of us because, first of all, they need to get back into the ring.
Mm-hmm.
They have enough money to go buy these things, and they're risk takers at baseline because they get punched in the face, right? So, of course, they're going to take more risks than me and you, right? So so I asked her about it. She said, oh, no, you don't need to do that. You're fine. I'm like, why? Why? So it's obviously never hit her practice. And her practice is probably as advanced as you're going to get in orthopedics on this side of the East Coast. And again, I'm just wondering how these physicians are going to start catching up to these things. Or is it just going to fall to the outside clinics who are doing concierge medicine and who are willing to be a bit more cutting edge? But then again, everything I've purchased at GNC for the last 42 years of my life, there's very little studies. There's certainly no regulation from the FDA. So is that worse than me buying peptides? I'm conflicted from an ethics standpoint.
Yeah, I think at this point it is gray area. There isn't a whole lot of research on the peptides for every specific use that people are now taking them for. They've been researched, right? They've been approved for other uses. So that has been done. But unfortunately, the way that big pharma, of course, works in the U.S. is it's money driven. So the pharmaceutical industry, like they want to be first to market and they want to be the only one to market to be able to do this. And there's only so many drugs that they can put through the FDA and through the different research trials at one time. So yeah, I mean, we know all the raw API is coming. It's China, Vietnam, and Russia. And
they're just set up to do pharmaceuticals as a baseline.
Yeah.
Yeah,
Like,
but that's
I'm sure
the raw material, right? So
Merck and all those guys, Pfizer, are buying their drugs out of there anyways.
Yes, exactly. That's
those
where
places
it
are just
comes
set up to
from.
do it from, right?
Right. And then, but once it goes from there, it's who does it go to, right? Do you trust who's actually selling you the peptide and what form they're selling it in? Are they in a lab? Are they in a pharmacy, a compounding pharmacy? What is it? Or is it somebody in their basement that's putting this thing together for you? And we've heard stories of that. I mean, everyone on the internet who's researched peptides has seen those stories, and I think that is happening as well.
Right.
And so anything that we bring in, obviously we're looking at safety first, and we're looking at accreditation. We're looking at, are these safe labs? How are they handling it? Are they third-party testing it? Are they third-party testing every batch? And can we get those certificates at the drop of a hat when we request them?
I guess it helps me frame it for your business. I should be looking at it or thinking about it now that you guys are like a concierge, medicine.
Concierge wellness, I would say, yeah.
Fair. It's funny you mentioned the pharmaceutical companies. So retatrutide is like the new GLP out there. And there's a big GLP fight
Oh, yeah.
in Bermuda with price of GLP drugs.
Yeah.
I mean, I know enough to be dangerous about this topic, but apparently the pricing was really high, being charged by the pharmacies. Health insurance companies were having a fit because they're paying out the nose for these drugs. Doctors are prescribing them because, great research showing, obviously weight loss, but insulin sensitivity, really sweeping the market. If you're on the more cutting edge of peptides that, I physically find myself today, GLP-3s, third generations, is retatrutide, and that's in a massive fight with one of the pharmaceutical companies because they're trying to call it a biologic.
Yeah.
And now I'm well over my skis. So I'd love to hear the difference between what is a pharmaceutical versus, where the peptide sits today versus biologics, because there's some biologics, I think, for like gout, as an example. But I'm well over my skis here, so please educate me.
Yeah, so I think, well, first, the explosion in the interest of these, it was originally weight loss, right? People wanted to lose weight, not because they necessarily were obese, but because they saw that this had amazing effects. But in terms of, it's one of these things where you look at the insurance companies and you understand they've got to keep costs down, right? And they want to do what makes sense. But in terms of prevention, if someone can bring down that weight and come off of the obesity scale, then they're going to see health impacts that are far greater than just fitting better into their clothing and being able to go for a longer walk. But these things are newish, right? So we don't have long-term studies. So we can't tell in 20 years, is that person not going to have the heart attack? Is that person, not going to end up in long-term care because 20 years earlier they took more control of their health and wellness journey and put in place protocols and did peptides and lost the weight and kept it off and all those kinds of things. So I think so much of this is so new that's a really important piece. But the studies that we are seeing, even addiction, right? So it talks about appetite suppression, but they're looking at it that it's suppressing alcohol use, it's suppressing drug use, it's suppressing smoking use. So all these things that we know impact overall health and well-being. So, some are calling it wonder drugs. It's way too early to call these things wonder drugs until we've got some more research and some more data behind it. Right. But I personally think it's a game changer. And I think it's going to have a massive impact on health and wellness of most people. That leads into that whole gray area. What are companies and different regulators going to call peptides and some of these other things, coenzymes, all the different things that you can add. To your point with the FDA, they classify something differently if it's an oral tablet versus an injection versus a liposomal, so there's different methods for the peptides as well, right? So I think it's way too early to really make any conclusions at this point.
Sure. And that we jump out of science into legal and then into regulation, which typically are three different categories altogether. I'm curious how you guys find, and it's probably a touchy subject, but how you find insurance support, especially for things outside of the traditional doctor's office. You guys are on the concierge medicine side. You're coming up with new and inventive things that insurance may cover or may not cover. I don't know if Argus is going to cover me if I go ask for a full body DEXA scan, right? I have no idea. I will ask and find out.
Yeah.
But they do have, credit to them. They have that wonderful executive physical I get every year. It's like $500 extra, and I go to Boston and I spend like a full hour at least with my physician to go over everything, which is a great concept. But that's not something I think they could offer to everybody. I obviously have to pay a delta for it. The things that you guys are rolling out, are you finding insurance cover for it? Or they're like, no, we're not touching it. Like, how does that work nowadays?
At this point, insurance is not covering, especially like the IV vitamin infusion therapy or our epigenetic test. We have approached some of the insurance companies just to say, hey, this is what's up and coming. We even read a paper that was published on life insurance. On an epigenetic. So if we were both going in to have our life insurance valued, you could do it based on the epigenetic part of your life, like how well you've been living your life, and that could affect your premium for your life insurance. Because right now we're all boxed into 40-year-old female, and this height, this weight, versus I could be living my life really well and I have a biological age that's much lower than the next person beside me, but we would be both charged the same amount.
You're on an actuarial chart.
Yeah.
Yes.
Yeah.
Right. They go, I'm 42, I'm a male, I'm 6'4" and 245.
Yeah.
Congratulations. Here's how much we're charging you.
Yes.
And also I can see when you're probably going to die.
Right.
So here's our insurance coverage. Here's our life insurance coverage. Congratulations. What I'm doing in my life, they seemingly don't equate into my health insurance. I work all the time. I try not to eat a lot of carbs. I play sports. I don't get a discount for that. There are I've heard of a few discounts for some things, but it doesn't seem to be a thing the insurance companies are grasping with.
They are looking at wellness. They're looking at wellness programs. So we have partnered with CG on their wellness program. So they are aware of us, and any of their members can come to us for a discount. So they do see the value. I think it's getting the change, right? Like, I think in my past experiences of working and trying to get certain services covered within the medical field, insurance companies meet only X amount of times a year. Changes only happen X amount of times a year. It's not progressive or forward thinking. They can only do it within the realm and time that they can.
Right. I mean, I agree. And if your thesis statement would be, we are all going to be on peptides or the next class of really drugs. I mean, statins were supposed to be, and I think maybe there's some data to prove, kind of a wonder drug. Heart attacks and obviously cardiovascular risks when people on statins were dramatically reduced, if I'm correct. Fact check me. But that was a class of drugs that I don't know if they were widely prescribed, but I don't know if they were widely penetrated into the regular population. And I don't know if peptides will get anywhere past, those of us who are kind of biohacking and looking for the next best thing. But you would assume all those things are driving down what I would intake or what I would use up in the medical field. Yeah. Assuming I'm healthier, I don't go for as many surgeries, I don't go for as many cardiovascular events, I don't have stroke, all those things. But again, we're not seeing those reflected on our premiums. Right. I can't write to my insurance company and go, well, I'm at the gym and I'm drinking a lot of water,
Yeah.
and I eat a lot of protein, and I take creatine, and I take peptides. So can I have a $100 discount, please?
Yeah.
That's not happening right now.
No, I mean, homogenization, stereotyping, that's easier, right? It's the same thing with a multivitamin, right? You get a men's multivitamin or a women's multivitamin, and that's a woman aged, 18 to 100. And so this is where this sort of concierge, bespoke, tailored wellness data of who you are down to a cellular level that's why we're doing this, right? Because we know that everyone is different. Claire and I are approximately the same age. We're both white. We both live in Bermuda. We're both fairly healthy. We eat well. But our DNA profiles are completely different. What she's deficient in and absorbs, maybe I don't, right? And so it's getting back to the data. It's using the technology that's available to then figure out a path that makes sense for you and not just for, the average woman out there, because there is no average woman out there.
And I think the GPLs, that's what most people know. Peptides, that is your insulin and your GPLs 1, 2, and 3. They're going to become like tools, right? So when it first started, everyone was injecting high doses and losing extreme weight really quickly, right? Like that's just the era that shouldn't have happened. And now that it is a bit more managed, everybody knows now it's like you're microdosing versus. So it's a tool to help you lose weight. And
still need to go to the gym.
You still need to go to the gym. You still need to eat well. You still need to do the things. But I think it's like a Kickstarter, and can help build somebody's confidence to get themselves back to where they want to be.
So where do you see? Like I come in, I get my genetic testing. I'm on my my health plan with my physician, and then maybe a specialist, and now I'm in concierge medicine. Where do you see concierge medicine going? I get my genetic testing. I start, doing extra things that are probably pretty beneficial, like the DRIPBaR. Where do you guys see the next level? Because obviously there's some things that, if I'm scientifically honest, are just way outside in the hemisphere of doesn't work, which, my favorite example is typically acupuncture, chiropractic. I'm not a fan. I did chiropractic. I blew up my back, L405 herniation, working as a fireman. And that was horrendous. And chiropractic was great and low back to give me some relief for a few days until the pressure, returned. But some of the chiropractic stuff and some of the acupuncture stuff, I just can't find any good research on. So how do you guys find that line of like, oh, this is the next, red light therapy is a great one. I think there's a lot of good research out there for red light therapy. And I think you guys are saying that's coming or already evolved in your practice. But
Yep, we do have it already. I think we go to conferences. So you go to different conferences and you've got, experts in their fields that are giving you data-based presentations. And you also have the guys in the vendor area that are like, this is the next amazing, best thing ever. And you can try it out and then obviously do your own research about it. So I think that's really important is, getting off Bermuda, going out, exploring, doing the research, using the AI tools, because things are changing so quickly, right?
Yeah.
Like 5 months ago, you could buy some of the peptides in the U.S. that you can't today, and maybe this summer after they have the meeting in July, you'll be able to buy them again. So the world changes really quickly, and so as sort of the experts in this, we have to be way on top of that.
Right. And I've seen the formulary in Bermuda not change dramatically. How is Bermuda reacting to some of these things? I mean, I got prescriptions just because I don't want to talk to customs longer than I have to. But I don't know if I needed it. It's a drug coming through, but is it regulated by Bermuda? Like, where is Bermuda in? I mean, I feel like we're slower than the FDA, and the FDA is glacier sometimes. Do we just rubber stamp what comes through the UK and the United States, or you think is there committees that look at these things?
With regards to like pharmaceuticals, there's a pharmaceutical association, and it's mandated by the Bermuda Health Council. So, if you open up a wellness facility or a medical facility, you have to, you go through the Health Council to get, registered with them. And then you have to comply with whatever that they're asking you to do.
Right.
Everything, like through the DRIPBaR, we're physician-led in the sense that we have like our medical MD, we have a pharmaceutical team, we have...
in effect, it's a prescription.
Right. So everything that we do is stamped approved by a physician, right? So, we're not, I think I always joke, we're not the Swedish chef in the background just, deciding what somebody's going to have. Right. Everything that has been approved by a doctor.
Yeah. No, that's amazing. Switching gears a little bit, you were doing healthcare funding or funding for nonprofits and startups.
Yep.
Yeah. Love to hear about that. I love the Ignite program. I went through it myself for, when I was stuck on the air ambulance and looking for, solutions.
Yep.
Also, one of the things I learned from the Ignite program was entrepreneurs are probably, I'll use the word, and I don't mind loaded terms, hated by the insurance companies because we're so on top of using resources available to us, right? So if my insurance said I can have 5 mental health therapy sessions a year, and I can get 2 pairs of eyeglasses from the optical company, and I get a $50 discount if I sign up to a gym. I mean, most entrepreneurs see that and go, tick, tick, tick. I'll do all those things.
Right, absolutely.
But I'm curious your Ignite experience, and also because I'm a big supporter of them. I love the charity, and I'm also curious on how that part of your business has grown and evolved, or where it is today.
Sure. So we love Ignite as well. It's an amazing, amazing program. I'm sure you've probably talked about it multiple times on your podcasts, but any entrepreneurs that are looking at starting, developing, even if you're ready to sell, Ignite is a fantastic resource, and we encourage you to seek out their help and sign up for their next program. My business Wavecrest started in 2018, so I've been working with and for nonprofits, most of my life. Like a lot of Bermudians, you grow up and you're selling raffle tickets from your school, and you're doing a walkathon, and you're helping to pick up trash. And so I think we live in this wonderful philanthropic environment anyway. Most people go to church, or at least used to, on a Sunday, and you see your parents giving every week, and you know why that's important. And so I worked at the Bermuda High School, and I helped them to run a $10 million capital campaign for an innovation center, black box theater, and arts wing. And through that process, saw that there weren't really fundraising consultants on the island, certainly that were helping with capital campaigns or getting set up for them. And so when I left BHS, that's when I started the company. And I've worked with about 35 local nonprofits, and then also in Canada and the US occasionally, to help them really have the tools necessary and do the right research. So like anything, the preparation before you start something is going to determine how successful you're going to be with it. And we have a very vibrant nonprofit sector. Unlike a lot of sort of modern societies, our government doesn't currently provide some of the services that you might see in the UK, in the US, Canada, Britain, France, all the rest of it. And so nonprofits have really an important role in our society here in Bermuda, and so we need to support them. And they're small and they're large, and they do well on an annual basis, but occasionally there's an opportunity where they need to raise what we call capital funds, and so those are much larger funds. So everyone knows about the aquariums capital campaign that's going on. I haven't helped with that one, but that's a good example of, they needed the community's support, they needed government support, they needed corporate support in order to make all the changes that they needed to make at the aquarium. So that's the kind of stuff that we focus on at Wavecrest. We've worked in all sorts of nonprofits and in all different areas: strategy, communications, and fundraising.
I mean, the medical side is, I think, a gap that nonprofits are filling a lot of.
Absolutely.
I sit on the board for Age Concern. Maybe one of the only charities that focuses on seniors, maybe the only charity. There's some other charities that kind of come in and out of that space depending on your particular ailment.
Right.
Vision Bermuda, as an example, or Diabetes Association. But there is a huge gap there, I think, that, and I'm sure in other countries, Red Cross is not as big here, but Red Cross, as an example, fills in disasters, for homeless shelters, et cetera. Where are we sitting in healthcare with the spots that you're finding nonprofits are sitting into and filling the gaps?
Yeah, I think one really good example is Bermuda Cancer and Health Center. So they are a charity. And so many cancer centers around the world will have charitable arms or foundations. They, by their ethos, are a charity entirely. And one of their main tenets is that anyone that walks through the door that needs any kind of support, whether that's an annual mammogram, whether that's $100,000 worth of radiation, doesn't have to pay a cent. So whether they have insurance, don't have insurance, whatever kind of insurance they have, they never get a bill for anything that is done there. And that's fantastic. And I don't think enough people know about that. They're one of my clients, so I know that. But even I didn't know that as a Bermudian who's lived here my entire life almost, that's what they did. And so there's plenty of other stories like that of nonprofits that are filling gaps. and either subsidizing or doing it for free because that's what some people in our community need.
Right.
Yeah, like the Bermuda Diabetes Association, like they do phenomenal work, right? They do free eye tests. We helped them do kidney screening.
Their building is
right?
ridiculous.
They also have a
amazing.
pharmacy, right? A pharmacy that I believe is actually one of the cheapest ones on the island, and they don't advertise it because I don't think you're allowed to. Then also, they also
Go to the diabetes pharmacy.
Then also, they have a clinical pharmacist who does Know Your Medication program. So you can go in free and bring your big bag of medications and sit down with this pharmacist for an hour, and she will go through everything with you and lay it out in a way that helps you understand why you're taking those medications and what time you should take the medications and how you should take the medications. And again, I think it's just not, people don't know about it. We encourage all our clients to do it, but it's something that is done for free. It's of no charge.
I mean, we're really fortunate. We're sitting in the middle of one of the biggest capital industries in the world, reinsurance, and then a sidecar we have ILS, international, and banking, and then some hedge funds. So we're really fortunate to lean on those companies and those individuals to donate. But it does say that maybe we as a country need to figure out how we can also help with those charities. I grew up as a volunteer in the fire service. Initially, I was unpaid, riding for free in the fire service, and then EMS, and then I've always volunteered in other things, like I said, age concern. I just don't see volunteerism in the United States, where I'm still very close to, or in Bermuda. It seems to have disappeared. And all these charities, they have some paid members, but I think they're relying more and more on raising funds to cover for staff, because they can't get enough volunteers to fill in the slots that they need.
Yeah. First of all, thank you for your volunteer work, because it is important. Our society
I got
does
much
not
more
run,
from it than I gave.
Right. But our society can't run without volunteers, right? But what you say is true, and I've kind of tracked this because I love data and I'm interested in this kind of stuff. And there's definitely been a decrease in the number of volunteers, and there's some reasons around that, right? So you go back 40 years ago, there were a significant number of more wives that weren't working, right? Sure. Wives and mothers who weren't working. And so within the hours of when their children were in school, they would volunteer, right? Now we see so many more families, Bermudian and expat, where both of the parents are working.
We're a society almost across the world as a double income society.
Right, absolutely. And it has to be because everything is more expensive, right? And so that was a natural declination in volunteers. I also think even our students, it's built into a lot of the school curriculum that they have to do community service, but our children are overscheduled and have way more things that they can and want to do as well. And so I've seen student volunteering decline as well. And then if you're not doing it as a student, are you less or more likely to do it as an adult if you have a limited amount of time? Or are you going to spend it with your friends or reading or coming and getting an IV with us? Right. So, there are some real reasons as to why it's gone down, but it has absolutely gone down. And then that's also been a shift in communicating from nonprofits to donors, that when you look at our operating budget and we have more people or we have more admin or, whatever it is, this is the reason why, so please support it. Because in the past, donors would want to see that almost 100% was going directly into services, the humans, the animals, the environment, whatever it was, and they didn't like to fund operating costs. Right. But if you want a nonprofit to run well, to run efficiently, to deliver the services, you've got to have it operating budget that supports that as well. And so that's been a shift in conversations around philanthropy too.
Yeah, and it's not. I'm a capitalist. And I love volunteering, but I also find that for-profit companies, for the better or for worse, typically do capital allocation a lot better. And I'm also gravely concerned in Bermuda with CIT, corporate income tax. Yep. I think the outside opinion would be CIT is not going to affect third sector. I don't see how that's possible. But a question for another day, I suppose. On the healthcare consultancy side, where are you guys finding your niche? I mean, I know nursing support is a huge one.
Yeah.
Getting people, return to physicality. In the sports world, they call it return to sport. But getting the senior citizens out and back mobile and healthcare at home is a big one. But I'm sure there's other gaps in the healthcare industry in Bermuda that the consultancy side is starting to fill.
Yeah, so one of the programs that we worked with was we had a US-based company who had kidney. They wanted to screen people who are at a high risk of kidney disease, and we were doing it at a point of care testing. So we did that for a year, where we gathered all the information. We went to specialists, GPs' offices, and the Diabetes Association also, because anyone with diabetes is at risk of kidney disease. And we ran that for a year, collected all the data, and submitted back to the government. So when the kidney care pathway was released, then point of care testing and screening was one of the larger recommendations. So getting out and kind of identifying gaps and problems early is something that we've been doing. We've helped doctors' offices go electronic, right? So everyone is very much paper driven, and that's just the culture it is in. There's far too many EMRs right now. Everyone's just picking an EMR. They don't know why they're picking it, and of course
we have 4 different healthcare customers,
right?
And 4 different EMRs.
Yeah.
What's going on?
Yeah.
Right, there's no standardization of it. It's still doing the same thing. And then we go in and someone will have bought the state-of-the-art EMR, but it's really just, a fancy filing cabinet, because they're scanning their documents in and there's no information coming back out. So it's kind of showing them, if you data entry correctly, then you can pull out reports that's going to be useful for your end of year, for your board, for making the changes. So presenting something back to a team to say, hey, I think we need to change or pivot this way, because the information that we've been collecting over the last year is showing us that hypertension is on the rise, and we need to now start looking at one of those targets. We try and have the physicians and health look at, targets, outcomes, right? We're not an outcome-driven society. We're very much fee-for-service. Everyone is sick, goes to the doctor. So there's no outcome-based care. So how many doctors are, and they're not being there's no response held accountable to that. So there's no, annual quality report that the Health Council or the Ministry of Health are holding our care services to. So no one's really looking at, if I'm a physician and I've decreased HbA1c down to a normal level, no one's really seeing that information. Or if I'm really taking people off medications, no one's seeing that information.
Is that a pathology problem? Is PATH not looking at these things across the demographic?
I think if you look at the UK, it's the government put outcomes. You have to meet these targets, sure. And then maybe you can be financially rewarded, or you get more funding, or you get more opened up, or you get more some more finances towards certain services. Right. Yeah. So it's kind of motivational driven. Yeah. We're here, everyone who's sick, it's fee for service. So there doesn't seem at this point, I'll just keep my calendar full seeing sick people.
Sure. Yeah. It's fair. If I hire a personal trainer and I'm not lifting 10 more pounds in a month or 3 months, is my money well spent? Right. The diabetes thing is interesting. I'm super curious. We probably don't have the data yet. Some of these things that we talked about today are fairly new, the GLPs as an example. Yeah. But I am curious. I remember talking to Leahy, because obviously for the air ambulance, we talked to the hospital services pretty regularly. And at the time, I don't know if this has changed, they had 40-plus people waiting for kidneys. And I think it's well known now, everyone knows Bermuda has a very high rate of kidney disease, high blood pressure, high blood sugar, et cetera. How is that translating? Are you starting to see movements on that in the demographics? Are there some evidence that the GLPs or lifestyle changes, sugar tax, any of these things pushing that number down, or are we just as a population, hopefully not present company accepted, but my wife did just buy me a whole pack of Oreos the other day.
And how much of the packet have you eaten?
I haven't found them yet.
Oh,
so
there you go.
She bought them and hid
motivation.
them. Give me a week.
I think we can only go by the clients that we see, and normally everyone is pretty motivated to make some changes. So we have people who come in and have 2 infusions in a month, and they feel it's helping their menopausal symptoms, right? So it's how they feel afterwards, right? So they are seeing a benefit by coming in, and they're kind of religious that way. We have people who, with the GPL1s, 2s, and 3s, it's too soon to say, what the long-term impact will be. But we do see people who come in and they're happier and they're returning and they're feeling better, and that is a big thing. We've had people say, they feel more motivated now to do things. They feel better. They feel well.
For the I mean, as a simple thing, if you can get, I said this the other day to somebody, if people took care of themselves, I would probably be out of a job in healthcare, running a nonprofit. But they're not, right? So, for one aspect of it, the industry survives off people making poor choices and not exercising, eating well. But I am super interested to see how these new age things, we say new age today, to your point, they've been around for a bit, to be honest, affect these outcomes. I mean, imagine if the government and the insurance companies in Bermuda as a whole went from, 100 kidney transplants a year to 50, right? And we've done nothing else but just done the right things, improved our healthcare. I mean, taking the GLPs, eat right, et cetera, exercise, do, as every doctor would say, you can't just do one thing, you got to do it all.
Right.
But get that number down. Imagine the cost savings. I'm assuming a kidney transplant's got to be $500,000. I mean, it's a lot of money.
But where's the accurate information? There is no information. There is no. So that's when we started doing the kidney screening. Though I think it said like 6% would, and that's not the case. But we were identifying people in severe kidney disease that needed like actions straight away, and that was just people walking around going, "Yeah, I have a bit of blood pressure, I have a bit of sugar," but you're like, "Wow,
they're a kidney failure."
More or less heading that direction.
Right, yeah.
And the really good thing about that program was that we had engaged with specialists and nephrologists to say, hey, I just want to make sure that if we're doing this program and we're collecting this information, there's a pathway for these guys to go, because it's normally going to be somebody who is underinsured. So you're not going to turn around and say, hey, we've just discovered in this point of care testing that you may possibly have long-term kidney disease. You're going to have to get it verified, and now you need to go see a nephrologist, and that's like $350, and they're going to be like, no, I can't do that. I'm come here for free because it's free. Right. So we made sure that there was a pathway for them to see a nephrologist while on that program. So there's no data. That's it. So when we presented those information back to the government, like the numbers are very high. Right. So if we're not pulling from something and collecting the information, then how do we know we're doing better?
Yeah, and I think different organizations, different companies, different people are collecting some data, and it's how do you pull all of that data together and have the Department of Statistics or a think tank, a nonprofit, like whatever it is. It's just not being gathered. It may be being collected in different areas, but who knows, right? And that's the problem with a lot of things, not just with healthcare in Bermuda. We don't have enough data, or it's not transparent, or it's not communicated in a timely manner.
Yeah.
I mean, Bermuda is inching towards. We'll see if it actually happens. Politics is a wishing game sometimes. Universal healthcare is apparently coming down the road. The ministry has pushed it for a few years now, and there's been some campaigns around it. On one hand, the non-cynic in me says, look, if we have one buyer of drugs in Bermuda who can go out to market and buy all the drugs at the same time, if we can negotiate rates with overseas facilities, if we could give people incentives to do the healthy things that are coming from, wellness centers like yourselves, go get the right drugs you need to be healthier. The sugar tax, I think, was an effort to raise money, but also maybe an effort to try to get people to eat a bit healthier. I could understand that. On the flip side of it, the cynic in me and the American in me says, I don't know if the UK system works all that well. I've never seen anything but complaining online. Of course, I'm seeing colored things from news sources, so take it for what it's worth. But you guys have a feel of where universal healthcare might land in Bermuda? Is it going to be partially private, partially public? Which it kind of exists now. I mean, there's how many people are uncovered in Bermuda who get, in effect, free healthcare from walking into the hospital. But of course, that healthcare has a cap, right? They don't have neurosurgery.
Right.
They don't have, interventional cardiology. Like, there's a stoppage there of what the services the local government can provide. And then those people seemingly got kind of left in the lurch. And I think that's maybe where government's trying to fill this. But where do you guys see, what is a perfect system of healthcare from your perspective? Is it public-private? Is it all private, like the United States is?
I think it's a combination, and I think universal healthcare will only work if there is the ability for people to privately fund add-ons, right, the next level. I think we see that as Bermudians already. And this isn't always true, but we sometimes think, well, the care is definitely going to be better if I get off the island. And in some cases, absolutely. We're a small community. We have one hospital. It can't specialize in everything. And so there are some ailments where you do need to go overseas to be properly treated. But that kind of has trickled down to most things in medical that people think, and that's not necessarily true. But I think that for it to be accepted and implemented, you're always going to have people that are going to say, but I want more, and I want the ability to do that. And choice is important.
Right.
Yeah, like I think healthcare is a choice, right? I can't say enough about universal health. I was on some of the committees, and between cancellations or postponement, I don't know enough to say if I can see it working. Like I was excited to see, with our elderly, you get you get your annual assessment free. You get, they bumped up a little bit on the benefits, but then 2 weeks later they increased the insurance. So
sure, the cover, basically.
The coverage. So they did. They announced it to say, hey, this is a great thing. This is what we're doing for it. We see it. We know that we have to put more money into our elderly. But then if you're going to bump up the cost of their premium, then you're really not.
It's a wash.
Yeah.
Yeah. I mean, I see it from I think the most dramatic example for me is the physician side. I gave up 4 years of my life to go to undergrad. I spent 4 years of my life in medical school. I spent 4 to 12 years in specialty. So theoretically, 16 to 20 years, I'm finally, able to make what amounts to a big paycheck for the common folk, but I've also not earned any money for 12, 15, 18, 20 years. And then they get wrapped into a universal healthcare system that goes, well, I'm going to tell you how much you get paid, and that's your cap. Right. And that's a very tough conversation. If you, somebody famous, and I can't remember who it was, show me the measurement of success and I'll show you the outcome in effect, right?
Yeah.
And if
we
you
have
cap
to
those
attract people
reimbursements,
here. That's the other piece, is that we can't home grow all the doctors and medical staff that we need in Bermuda.
we have a nursing shortage right now, I think, which is
Yeah.
probably kind of beneficial to your business, but we don't have enough nurses on our
Right.
Yeah.
But if you cap what a specialist can make, how are we going to attract the best doctors to Bermuda?
Right, sure. So as we wrap, I'd love to
I
hear.
think that's where outcome care comes in, right? So if they decided to cap everyone's limit, then you would put in outcomes, right? Going, okay, so if you can show me that you're reducing, chronic disease by X, Y, and Z, then essentially your fee could go up.
Right, of course. I like the incentive-based programming.
Yeah, absolutely.
I suppose. As we wrap, I'd love to hear what you guys think your business is going to do, in the next few years, where you want to take it. What are the gaps you think you can fill in Bermuda, and are we leaving Bermuda? Are we hitting it's always funny to talk to people. I'm going to Cayman next, which is, Bermuda 2.0 in some respects. But
yeah, I mean, well, I'll answer that part first. So I think the Caribbean market definitely is one that is prime for more wellness and longevity centers. And I think that's really the way we're going. It's not just a DRIPBaR. It's looking at things holistically. It's looking at what's coming in the future. It's people understanding that they need to do more. You said earlier, we all know what we should be doing. We should be eating right. We should be doing this. But, that's only one piece of it. And there's more that you can do, especially when you understand more about yourself and perhaps what's coming in your future. Then you can put things into place. And there's all sorts of new, innovative technologies that are going to be coming to the fore that we're looking at. And we'll bring them here if we can.
Yeah. One of the other things that we're, Healthcare Solutions is looking at is we're really expanding on our occupational health service program. All our employees, there's not many, that we're really just focusing on what they are doing at work and keeping them healthy. So, we know that absentees, long-term sick time, injuries are always happening, and it's just, again, gathering that in one area and for information so that they can each improve upon.
Yeah, I love it. I mean, occupational health is a huge one. We'd have to go through all that, in fire and EMS. Are you getting power stretchers as an example? So you didn't have to lift patients manually was like a gigantic improvement in back health.
Yeah.
I think FDNY had a dramatic study on their ambulance service, how important
Makes
that
sense,
was. But yeah, that's great, guys. I really appreciate it. I will drop all your information, your business links into the titles.
Fantastic.
Thank you
of
so
the
much.
podcast. It's been a really great discussion. There's a lot more to unpack, but we'll leave it for another time. I'd love to get deeper into the nonprofits and CIT. I feel that's a nightmare unfolding in front of the third sector, but I guess we'll see.
Nightmare, but also potentially an opportunity.
Yeah, fair. Thank you. Have a great day.
Thank you.
Thanks,
Cheers.
Artie.
Thank you for joining the conversation on business and technology in Bermuda. If you found value in today's discussion, share it with your team. Keep building, keep leading, and we'll see you next time.